Philo for Thought's monthly Young Professional Empowerment Seminar. I'm Crystal Budis, and I'm going to turn the mic over to our co-hosts, Alexandra Liotopoulos and Andi Rustani. Alexandra?
Good morning, everyone, and welcome to our fourth installment, like Chris said, of our Youth Professional Empowerment Seminar series. My name is Alexandra Liotopoulos, and I'm the Programming Director at Philo for Thought, as well as the President of the Ikaros Hellenic Orthodox Club at Queens College. Co-moderating with me today is Andi Rustani, pre-med student at CUNY Hunter College, Medical Assistant at Lexington Medical Associates, as well as the Internship Director at Philo for Thought.
Thank you, Alex. Our last seminar focused on the ways as young professionals we can leverage our college experience and personal brand for successful networking and job hunting. Today's seminar will focus on the process of understanding and choosing employment and health benefits that best suit your needs and lifestyle. With us today are two premier employment benefits specialists, Maggie Stavrianidis and Bruce Boucher.
Bruce Boucher is the president of our strategic partners at Roos Advisors, as well as the director of the Masters of Human Resources Executive Program at Utah State University, where he also teaches several of the graduate and undergraduate courses. For 14 years prior to joining Roos Advisors, Bruce served as the Chief Human Resource Officer for Extra Space Storage, which expanded under his watch from a privately held company of 150 employees and 38 properties to a publicly traded company with over 3,000 employees and 1,100 properties. Bruce is a member and invited speaker at the Burson Deloitte Learning and Development Conference and the SHRM as a specialist on executive development, human resources, team building, personal accountability, and related topics. Bruce is also the featured speaker for several series directed and produced by Roos Advisors and strategic affiliates, including Philo for Thought and the New York City Network Group. Also the ongoing Career Chat, Build Yourself Solid, and New York State Real Estate series, which cover executive development topics on team building, personal accountability, and more. Thank you, Bruce, for being here with us today.
Pleasure. Thank you.
I will now share my screen.
Thank you. So it's so good to be with all of you this morning. Thank you so much for inviting me. I'm so impressed, and particularly to get with a group of energetic, enthusiastic college students or entry-level professionals on a Saturday morning. You all look good. You look like you're ready to go, and I commend you. Thank you for inviting me. We have great love and appreciation for Chris and appreciate her leadership in this particular area. And I'm grateful to spend my time today with Maggie, who you will be absolutely blown away by in terms of details. I wanted to just talk today a little bit as a friend, not so much as a professor, but a little bit as a friend about what's going on, what we're going through, and how that translates into employment, and then why health insurance is so important to you as you consider your opportunities going forward. So I appreciate Alexandra driving today, and we're just going to launch right into it. So I was on an elevator recently with an individual who would be about your age, and we were sort of looking at each other through our masks, and she made this wonderful comment. There's no denying this. This is bad. This whole situation with COVID was really impacting her. And I could tell that she was really, really anxious over it and feeling like her life had truly changed. And I think that this is a profound quote and really is, I think, a good summary of kind of what we all are feeling. Like this is different. It's not normal. It's not our norm. And it kind of feels bad sometimes. And experts will tell you that there are three distinct periods as we go through things that create change. And of those three periods, the one in the middle is actually the hardest. And it's called the neutral zone, right? I mean, it sort of has this really crazy, it sounds like almost like a television show. And in fact, Andi, you might be able to start a television show called The Neutral Zone, but it's really kind of the hardest place. And the reason why it's the hardest place is because we don't really understand when it's going to end. Like we get the beginning and we don't like the beginning, and the end kind of feels good because we're wrapping up and we can see the light at the end of the tunnel, right? But the neutral zone, nobody wants to be stuck in the neutral zone. Nobody wants to be in the middle where we don't know the end. And no one likes knowing or not knowing when it will end. We just feel so helpless, right? Everybody, and I love this thought, and it's kind of a tongue twister, but go with me on this. Everybody thinks somebody should know something about whatever, and that there is something not being done that should be done by somebody that knows something, right? And the truth is, we all look at each other, especially right now, we're all looking at each other and we're thinking, well, why doesn't that person do something? Why doesn't the governor do something? What about our school districts? Why are they doing that? And we have all these questions when really we need to start with us, right? And we need to be informed about what we really care about. For example, if you got COVID today, what would your healthcare options be? Where would you go? What would you choose? Would you be covered? Do you have insurance? All of these kinds of questions are questions that we probably ought to think about before. And as we concentrate on the things that we can control while we're in this neutral zone, we're going to be much better off because we're actually actively doing something, but we're doing something that has meaning and actually is something we can control. Information during this neutral zone period is very important, as is communication. One of the things that I consistently hear is, and I hear it from political leaders, I hear it from religious leaders, and I hear it from business leaders, that people feel like they're not getting enough specific and accurate communication. And trust me, when you listen to Maggie's presentation today, you're going to be blown away with how specific and how important it will be. Let's go to the next slide if we could. So while there's no denying that this is challenging, is there an upside for business? Well, I honestly think that people have made incredible strides. And one thing that we are seeing in the workplace right now is the incredibly important rise of teams. We've been talking about teams for a long, long time. But the truth is, teams are why people join organizations and why they stay. We talk about the company and the mission statement and the culture and all that. Now, it's teams. It's who you work with on a daily basis. And those team relationships during this COVID period have become invaluable. We've done a redo on higher education, and all of you know this as well as I do. How we're teaching. The old days of Professor so-and-so just sort of blowing in 5 minutes after class is supposed to start and begins a lecture and then, wows everybody and leaves. Those days are over. We don't do that anymore. Right now I teach in class and I have 27 students in a very large hall that I teach live. And then I have another 27 students that are joining me from all over virtually because of COVID. We have to do things differently. And we're all realizing that technology is keeping us afloat. And one thing that's really been interesting is for some of our companies, speed to market has changed dramatically. It's gotten faster. We've actually been able to improve. So where a software project or a manufacturing project or even healthcare services has taken weeks, maybe months to get done, sometimes even years, depending on the product. In those instances, those things have changed dramatically. And we're now able to get there a lot faster, which is great. The work from home numbers have increased. Obviously, we've gone from about 23% to well over 73% of the employee base working from home. And there's an increase in the importance of HR and helping people understand what's really going on. So let's go to the next slide. Is there a downside? Well, yeah, people are having trouble unwinding and unplugging because that computer is there and we got stuff. So another problem is, how do we evaluate work from home? what do we need? Do we need the big office space anymore? Are we going to need it? There's too little communication going on. Why am I not hearing anything from the so-called leaders of this company or community? And as I said, I hear that frequently. There are too many gaps. There's problems with production flow, logical decision-making goes out the window, and the normal functions change, right? For example, the Pac-12 just announced that they were giving their commissioner, their athletic commissioner over all of the athletics in the Pac-12 conference, they're giving him a multi-million-dollar bonus. And that was announced the day after they announced the reduction in force of several thousand employees. And you just wonder who thought that up? You know, who was brain dead that day and decided that that was a good announcement to have? So what does that all have to do with work? Well, it impacts work. All of this impacts work. How do we practice total quality management? How do we understand whether we're value processing things in our work if everybody's spread out everywhere? A staffer said to her boss recently, I love this quote, "I know this is going to shock you, but I actually and truly miss you," because people actually miss this interaction and this personal touch, so to speak, that we all wanted to get away from before COVID. Now we all want it back, right? Well, what does this mean for benefits? Well, one of the things it means is the way we used to communicate benefits, where we just hold a company meeting and we bring everybody in and specialists would come in and they'd explain the plan, or maybe they'd hold phone calls with spouses or whatever. Well, that's all changing. And we've gotten better and better at delivering this information electronically and or through technology. Let's go to the next slide. So what are we doing? First, we have to ask ourselves the question, what are we doing to mind the gap? And are we being proactive enough? So if you go to Europe and you travel in Europe and you're in the UK, for example, there's signs everywhere when you go to get on the bus or go to get on the tube, and it says, you know, mind the gap. So in other words, please don't fall into the space between the subway and the platform. That would be really bad for you and really bad for us. Mind the gap. Mind the gap has absolute application for us today as leaders in HR and as leaders in companies, because there's a gap between where we are as a company and our employees. And that gap is something that we can mind. And there's no wider gap generally, in my opinion, than what people understand about their health care. They just don't get it. And most of us come home, we have a packet from Aetna or Blue Cross or whoever, and we give it to our spouse or our significant other, and we go, here you go, tell me what you want to do. And people like Maggie pull their hair out because that's not enough, that's not good enough. And companies have to manage that gap. So here's a recent survey of what some of the HR professionals are doing across the country and internationally to sort of mind the gap, not only about healthcare, but just in general, right? They're holding virtual town hall meetings, which will be something that a lot of companies will do to manage their healthcare. They're giving video messages. They're doing ask sessions, weekly small roundtable groups with leadership, virtual team lunches, virtual hangouts. And then we get into some other stuff that's maybe not as important, but valuable in terms of emotion and that one-on-one contact. Netflix watch parties, get to know you scavenger hunts, sharing themed pictures, right? And then online cookbooks, et cetera, et cetera. Well, wouldn't it be nice if companies were creative enough that they made actually understanding their healthcare fun and enjoyable and attractive and important, and they didn't just say, here it is, it's open enrollment, you got this amount of time, we need your feedback, and then 2 days or 3 days before it's due, we start pinging them. Why haven't you done this? Why haven't you done this? Well, here are a bunch of examples of how we can communicate with people in spite of COVID and make it fun and also make it something that they can do and will do. We can mind that gap. Let's go to the next slide. So communication is currency, and we first things first. Number one, we have to get COVID right. In our businesses, in our offices, in our communications with people, we have to get it right. People have to make sure that they're safe. They have to feel like they're safe, and they have to make sure that they understand what's going on. Now, one of the ways that we can make sure people feel safe is that they really, really understand what's available to them if they have a health issue, right? And that's one of the ways. We as HR people will focus on making sure that the office is cleaned and that social distancing is in place, and we have our signs regarding you got to wear your mask in place and all of that. That's great. It's important. We have to do it. And it's an outward manifestation of an inward corporate commitment, right? We all buy that. And I think it's important. So we have to get it right, and we have to repeat ourselves a lot. But at the same time, if my wife gets COVID tomorrow, I need to understand what that's going to mean. And I need to be able to make preventative decisions and reactive decisions that make sense within the plan. It's important for employers because I don't want you going to the emergency room with a cold. I want you going to an Instacare type of facility, or I want you to stay home and have grandma bring you some chicken soup, right? And I want you to have those options. And so this communication and repeating ourselves, we have to get it right. So second, communicate. In communication, there's different ways to reach people. No one way works. We need to be authentic and honest. We need to be authentic and honest. And let me say it one more time. We need to be authentic and honest, right? And if I was giving a test to you today, that would be on the test. We need to be authentic and honest. So we can't go out and say, we're not going to have any reductions. We are going to hang in there. There's no problem. Or in this case, an actual company who contacted me after the fact who had said, the most we'll have is just a couple people, and we'll only do that in the most dire strait. And then within 2 weeks, they announced a 5% reduction in staffing without any warning. And that RIF, that reduction in force, impacted 180 people. And it started that day. And they called me and said, can you help us? And I said, no, I'm not sure I can, actually. But I'll try. I mean, that's just, in Spanish, we would say, no, never mind. It's just not very smart, right? And so we'll just keep going. But the truth is, this communication is important. And so it's not just about saying, okay, we're going to get rid of 180 people. What about their families? What about their health insurance? Are they going to go on COBRA? What are they going to do? What are we going to do for them? None of that had been contemplated. It was just a train wreck. So communicate, and we do it in a way that's authentic and honest. The number one characteristic of a leader right now in a recent survey that came out is empathy. Empathy is the number one characteristic that people want from their leader right now. That means leaders need to understand what's available to employees, and that means leaders need to understand health insurance. They need to have a grasp of it because it impacts every aspect of an employee's life. We need to be reasonable and invoke change management. Things are not the same. What processes should be changed? What policies should be changed? What healthcare decisions should be changed are all part of what we're doing right now in our renewals, right? We're trying to figure that out. Let's go to the last slide. So finally, going forward, empathy may be the number one leadership characteristic needed today because people need to bring their stuff to work. We always talk about this. When I started in the workplace, you didn't bring personal things into the workplace. You felt too vulnerable and no one cared. And today, the assumption that people are going to come to work and they're just going to put their stuff aside is ridiculous. It doesn't happen. And so we need to decide that we're going to be empathetic and we're going to think about people and the importance of people. I always challenge my teams and departments and companies that I consult with to please consider this as you go forward. Major issue, empathy, trust. We have to have those things, and they don't just easily appear. We work at that. We have processes of that. And communicating health insurance benefits and insisting that people who lead understand them are part of those processes. Now, really quickly, finding jobs right now. I've had so many young people come to me and go, I don't think I can find a job. That's ridiculous. You can find a job. You have to work at it. There's always room in an organization for great people, by the way, always. Always, always, always. And there's a place for you as you continue to work through this. COVID is not an excuse to not work necessarily. I think we just have to fight through that. And yes, people are losing their jobs. And yes, there's a lot of people out of work right now. And you know what? I posted 30 new HR jobs last week alone, me alone. People reaching out to me and saying, we need people. They're out there. And then finally, I would encourage you as entrepreneurs of talent to take opportunities to get better. There's always room for people on your team, and there's always room for you on someone else's team. I just got a note from somebody in Puerto Rico this week, 2 weeks ago, excuse me, that said, we have tons of jobs in Puerto Rico right now. Puerto Rico is a great place, right? It's maybe not Manhattan. It's not the Bronx, but it's employment and it's good. And so there are opportunities out there. Now, as I tie this up, I just want to say, again, if I could repeat, with all the things going on, one of the things that I think you have to get is you have to get that employees need support and they need information. And one of the pieces of information they need is health insurance and how it plays into their employment status and how it will protect them and help them. And I hope that as we continue to work through this new normal, that we'll consider that. It's been great to be with you. I'm going to stay on this, and you can always follow me on LinkedIn. You can hit me at Roos Advisors, or you can follow me at it's just Bruce Boucher. And I thank everyone for inviting me today, and we'll turn the time over to Maggie.
Thank you so much, Bruce. Andi? Right.
Sorry, I believe I was muted. Thank you, Bruce, for your perspective. We're going to move on to Maggie now, who's going to help us further understand how to choose health benefit options. Maggie is the Vice President of Compensation, Benefits, and HRIS at WIRB Copernicus Group. Prior to this, she held various leadership roles in global human resources and compensation for Johnson & Johnson. She specializes in total rewards packages, executive recruitment, talent management, and leadership development. Over the years, she has generously served as a mentor and guest speaker for Fuel for Thought, the Cypriot Chamber of Commerce, and various other young professional initiatives on topics related to personal branding, health benefits, interview skills, and networking techniques, which is the Fuel for Thought team refers to as positive professional identity. Above all, Maggie is known for her admirable balance of daily professional, philanthropic, and family obligations with exemplary organization and her signature can-do attitude. She and her husband, Dr. Peter Stavrianidis, were the recipients of Philo for Thought's 2019 Certificate of Lifetime Excellence for their years of community outreach and for the remarkable example they set for people from all walks of life.
All right. Well, Andi, thank you for the introduction. Good morning, everybody. Bruce, thank you so much for your presentation and for putting together some thoughts. And as I was listening to you, I wrote down some big takeaways. Communicate, authentic and honest, find a job, and there is always opportunities to get better. And as I was thinking of that, I was trying to put together in my thoughts the last couple of days. I changed this presentation so many times because when I'm looking at it, even the title, Understanding Benefits, Health Insurance, Employment Benefits, there's so much to talk about. And there's so much complexity that is behind those benefits. So thinking of how to become authentic and how can I communicate better with many of you that trying to select benefits, because November is the month of benefit selection and open enrollment for benefits for 2021. I thought, what is important for people to know? So, and here's my thoughts around what's you need to know as either young professionals or all of us selecting benefits and trying to demystify some of the information around benefits. I'm going to focus more around health insurance because now with COVID, this is what is in everybody's mind. What happens if I get sick? What happens if I have or don't have health insurance? So let's talk about some of those. Let's talk about some of that. So first of all, just basic. A health insurance is really a product that covers the medical expenses. It is important to know that what's covered, it's pretty much the doctor visits, prescription drugs, preventative care, it's also covered through a health insurance, and I'm going to talk more about it. But what is not covered is elective and cosmetic surgeries, any beauty treatments, off-label drug use, and any brand new technologies. Also, what is important to understand is that the health insurance, if you buy one, if your employer gives you one, or if you go in the open market and buy one, it does not cover 100% of the entire cost of medical care. It is actually designed in a way that there is a sharing between the consumer and the medical provider. So, and I'm going to talk about concepts such as an out-of-pocket limit, which is a wonderful term that you need to know and you need to remember, because that's the first thing that you want to understand. When are you reaching the out-of-pocket limit? Because if you do reach that, and by the way, it's an annual limit, anything beyond that is covered 100% in the health insurance. So wonderful terminology to remember, and I'm going to talk more about what is the out-of-pocket limit. Also, what is good to know is that all health insurance plans, they have 10 essential benefits. I did not know if people knew that. I hear a lot of questions about, is this going to be covered? Is that going to be covered? Little secret, all, and when I say all, health insurance plans, they all have those 10 essential benefits, and I'm going to cover very briefly about that. Also, they have to meet some affordability standards, which is mandated by the state, and especially if the plan is delivered through a government agency. So let's talk a little bit about those 10 essential benefits. If we can go to the next, thank you. So I'm going to let you read that. I'm not going to go through line by line, but I wanted to make sure that you know, and there is a little bit of kind of like deep breath. Oh, those benefits are covered. Great. Emergency services, hospitalization for surgery, prescription drugs are covered. Some about some of the lab services. And most important, and I put that as an underline, preventive and wellness services are covered. And that's important because you know how many people have health insurance and they don't do those preventive care services? That means they don't go for those annual visits. They don't go for cholesterol screening. They don't go for all those preventive care services that are offered, and they're covered at 100% in their health plan. And again, depending on your age, because particular ages, they carry particular screening. So depending on the ages that you're in and some of your conditions you have from your family history or from your own situation, those preventative care services are covered and are covered at 100%. For example, I'm looking at the list on the right-hand side, which again, I'm not gonna read to you, but it's all there. Mammograms, if you're a woman and you're of a particular age. Lung cancer screening, if you're a smoker and also you're of a particular age. Your hepatitis A and B, also covered. Screenings that are important for you and for your family to make sure that you do go out and you receive those screenings, because it will help then taking care of yourself. Because the whole process or the whole reason of having a health insurance is to be able to be healthy, so you can help your family and your and be a member of the society. So important to remember that those essential benefits are provided by all health insurance. It's mandatory. And then the most important thing, that there are preventative care services that are available to you within your health plan at 100% of coverage. Let's talk about some other things. If we can go to the next slide. Thank you. So there is a lot, and I wanted to talk a little bit about this Affordable Care Act. I know this is not a political statement. I'm not trying to talk about politics here, but I wanted to talk about some of the topics, because many people have questions about, as they listen a lot about Affordable Care Act or Obamacare, as another way of people knowing that through 2018, all American citizens, they needed to have qualified health coverage. So what happened is health coverage was almost mandated. And if people did not have health coverage from their employer, they actually had to pay a fee on the federal tax return. And this is to, not to penalize them, but actually to take money out of the participants and put it in a bucket from the government to be able to offer, as government does offer some plans. And there was a tax, therefore, charge that happened on your tax return if you did not select healthcare. And that it was a fee, actually, that it was calculated in one of two ways. And actually, whatever was higher is what people needed to pay. And it was either 2.5% of their household income or $695 per adult and $347.50 for a child under the age of 18. So what happened, as of 2019, this particular mandate has been suspended and no penalty now for not having health insurance. So that is what you're hearing a lot of politicians talking about what had happened. You hear some political candidates saying the Obamacare, they stop, they will increase, they will do this and they will do that. All they did is, as of 2019, they actually suspended the mandate on that particular tax element that people without health insurance had. More to come. We don't know what's going to happen in reference to the Affordable Care Act. However, you know of this tax that it was posed to people that they did not have health coverage. What happened is many companies, many organizations, if you did have coverage through an employer, the employer had to provide to you a proof of coverage, which then you use to say, hey, here is coverage that offered to me by my employer. I don't need to be charged this tax. That's as simple as I can make this information to all of you. If we can go to the next one. So is it important to buy health insurance? Like, why are we talking about coverage? And I am I'm using that because why did the government put a tax? Why everybody's talking about health insurance? And should you buy one? The answer is yes. And the reason is medical expenses are very high to cover out of pocket. And I'm not trying to scare you, but actually I am. And I'm trying to scare you to tell you that look at some study that happened. 65.5% of all bankruptcies in the United States are tied to medical issues. Actually, this is something I found because I was researching it. I've heard it in the CNBC, and then I found the article posted on the CNBC site, posted on February 11, 2019, that actually went out and they did this analysis. And they find that 65.5% of all bankruptcies in the United States are tied to medical issues. Isn't that an interesting one? And an estimated 500,000 families, they turn to bankruptcy because of medical bills and issues. Now, if you care what is the other reasons for bankruptcy, you can read them there. It's anything from, not paying your mortgage all the way down to having a divorce or a separation. Am I trying to scare you? Yes, I am. But I am a lawyer. Actually, my training happened as a law profession in Greece many years ago. So I want to debate that. Yes, indeed, I'm trying to scare you. However, if you don't buy health insurance, there is always another way. You can buy, and if you go to a doctor, and please do go to the doctor, you can pay it out of pocket. You can really have a discussion if you really want to know with the doctor and saying, listen, I don't have an insurance. I want to come for a visit. How much are you going to charge me? They will tell you that if you call them. If you want to have a blood work, by the way, you can call or you can go have the blood work. They ask you, do you have a health insurance? People usually get intimidated if they don't, but you can pay cash and you can pay out of pocket. So there is a way to actually cover particular illnesses. Now, if you have an emergency, a situation where you end up in the hospital, appendectomy or something that requires serious health treatment, that's when it becomes challenging to actually afford it. But if you want to go to a doctor, if you want to go to a dentist, if you want something to address your medical need, you can have that, and you can actually negotiate directly with the doctor or any provider. You can pay out of pocket. You can give them cash, but you can give them a check and pay for that coverage. Absolutely. So yes, I'm trying to scare you here to say we do need to buy health coverage. However, it's not the end of the world. And hopefully you are, with some information that I'm going to share later on, you are going to look at your coverage provided either by your employer or go out to the open market and find coverage. There's many solutions available to you. And then in the last case, if something happens, you can always find a place to actually provide healthcare to you, and you have to pay out of pocket, typically cash or check or however you want to do that. Let's go to the next one. So now when we talk about health insurance and buying health insurance, there is two types of insurance that you buy. It's private health insurance, which is typically offered from an employer. By the way, all employers with 50 or more full-time employees are required to offer this full-time insurance. If you work for a small employer and you wonder, do they offer health insurance or not? If they don't have 50 full-time employees, they don't offer health insurance. Also, from a private perspective, you can purchase it in the open marketplace. And there is two places. It's the on-exchange private health insurance policies that can find in the government side. And please make sure that you do check those resources. Healthcare.gov is the place where you can check the resources on the on-exchange private health insurance policies. And also, they're off-exchange private health insurance, companies such as Aetna, Cigna, these are all private health insurance policies that do exist in the open market. In other words, they're not going through an employer, and you can actually call them up. You can look up information directly on their sites. They have, now that all of us are in a remote place, they have great resources to actually give you information about how much is it gonna cost to buy that insurance. And do remember that they all have to cover those 10 essential benefits that I mentioned in a prior slide. And then there is public health insurance. And I'm going to talk more about that. And the public health insurance is Medicaid, Medicare, and CHIP. And I'm going to talk about a little bit more on about those public health insurance. So if we can go to the next slide, please. So now that you know that you can buy a health insurance either through an employer, I mentioned, you can go to the marketplace and price in the marketplace plans, or you can look at government-related plans. An important element is what is that you need to know to compare those plans. So what is important to know? And here is a couple of terminologies that I would like to share with you. And the number one is, what is your out-of-pocket expense? Do you remember in slide 1 that I mentioned about this out-of-pocket? And remember that I mentioned that not everything will be 100% covered, that there will be some out-of-pocket expenses. That is what those 5 things that you do need to remember. First of all, the first one is the premium, which is your monthly payment that to the insurance plan. The premium, another way of understanding what premium is your membership to the club. But the membership to a club doesn't mean that everything in a club is offered to you. It's just your monthly payment that you made to that particular provider. Sometimes it's your company, if that is offered through your company, and is a monthly payment to actually have access to a health insurance. Another one is the deductible. In other words, how much to pay for the healthcare services on an out-of-pocket before the health insurance plan kicks in. Another important one. And by the way, all insurances, they have a deductible, and before you meet that deductible, you have some co-payments, which is the next one that I'm talking about. You need to understand what is your co-payment. In other words, a fixed amount that you will pay for a specific service or prescription. Also, you need to know that there is a fixed amount, the co-payment, as I mentioned to you, but there is also another non-fixed amount, which is called a coinsurance. And a coinsurance is the percentage of the cost that you are paying for covered services. And in most of the times, the coinsurance is around 20%. If the plans are provided through an employer, they range anywhere between employers, in other words, pay or contribute to those plans, are around 80%, 85%, depending on the place that you're in. And the most important thing to remember is that, all right, so you said, Maggie, that I'm buying health insurance. You're saying that I need to pay. So is it ever gonna hit a ceiling? Am I gonna continue paying? Because if that is the case, then why do I need a health insurance? Indeed, there is a maximum out-of-pocket expense, and all health insurance, they have that. In other words, if you reach that, the rest of it, it's 100% paid. And as you can see, the maximum out-of-pocket expense, it is for 2020 is $8,200 for an individual and $16,400 for a family. You say to me, that's a lot of money. Indeed, it is a lot of money, but also it means that you had a lot of treatments to be able to reach that out-of-pocket maximum. In the meantime, if you don't, you have the premiums, the deductibles, and remember I mentioned to you about those preventative cares. Those are 100% covered, and you will be able to get coverage by actually going to those preventative services. Now, so when you're comparing the health plans, you need to know about those 5 items. Therefore, you can compare them side by side. Also, you need to know about, there is a lot of different type of health insurance plans, and HMO and PPO and EPO and POS. Lot of information. And are they trying to make it confusing enough for us? I'm not sure. They're trying to, the purpose is not to make it confusing. The purpose is to find ways to actually offer coverage to participants and develop plans that are relevant for them. I'm going to cover some of these terminologies as well. But the last one that you need to know to compare the health plans is to compare networks. You want to make sure that the doctors, if you visit particular doctors, they're part of a network. Because if something is part of the network, it's covered, it has less cost for you, but you can always use also things out of network. Another great terminology that, that you need to know and understand. So if we can go to the next slide. Here, I'm giving you a little bit of a description. I mentioned a lot about HMO, PPO, EPO, POS, great terminologies. And here is some of the description and a core feature. The core feature is the difference between having a primary care doctor, which is really one who coordinates your healthcare. Some plans require that you have, and you see a primary care doctor, and gives you therefore less flexibility because you have to make an appointment with that doctor, and then that doctor has to authorize your visit into the next specialist. And the difference also between those plans is that some of them, they ask you to stay within a network to cover particular coverage, and some of them, some procedures actually, or specialists require a referral from your primary care physician. So for example, an HMO, a physician has, if you're gonna go see a specialist, your primary care physician first needs to give you a referral. Same thing if you're in POS plan. And maybe you take a picture with your phone, because that's a good summary of what the different plan means. They're not trying to make it difficult for you. They're trying to actually give you different choices. As a consumer, you just need to understand what are the coverage between these plans, and most important thing to understand how much you pay, what's your deductible, remember that, and are your doctors within your network. If I can summarize these last two slides. Can we go to the next slide, please? So when do you buy health insurance, actually? And if you work for a company, actually when you do join the company, they offer you health insurance. Some companies, they have a waiting period. So check their offer package to you, because there is some waiting periods that some companies are doing. And the reason they're doing a waiting period, because some people, they're only for a period of time, or it's not gonna work. Another time where you buy health insurance is pretty much now, next month. It's during the open enrollment period. And that is when the companies and government, as you can see in the open marketplace, the open enrollment period starts in November, and it lasts all the way in December. For private employers, or for if you work for a private employer, typically they start in November. It's anywhere between 2 to 3 weeks for you to make changes and to actually enroll into a plan. Also, if you don't enroll into the plan, unfortunately, if you're in a private situation, even in the government, you have to wait for the next year for that opportunity to be available to you. A little tough if you don't make that decision. So it's important to know that you need to pay attention to that open enrollment. However, in case that you have a qualifying event, in other words, in case that you turn age 26, if you're married or if you're having a baby, that is what triggers a qualifying event for you, and therefore you don't have to wait for that open enrollment season to register or to buy health insurance, but you can it gives you the opportunity to buy health insurance during that time. Let's go to the next one, because I want to cover some general information about, so what is Medicare and what is Medicaid? We hear a lot about that. A lot of people are confusing the two because because they both have the word medic up there, and one is a care, the other one is an aid. And they're both health insurance programs that are administered by the government. And there are differences on how these two programs and how they share cost with you. We live in the age of the internet, and therefore I absolutely encourage anybody to understand about these programs, and there is plethora of information in the government sites. For Medicare is very straightforward, www.medicare.gov, and for Medicaid it's the same thing. So please make sure that you look at those sites, and they do provide information about what each program is all about. And if I can summarize it, Medicare is really a federal health insurance program for people who are over 65, also covers with particular young people with disabilities, and also they have people that you're eligible to actually go to Medicare if you have end-stage renal disease. On the other hand, and by the way, they offer different services. You can read the slide. There is a hospital insurance, there is a medical insurance, and there is a prescription drug insurance, and you can choose if you are in one of those categories. Then the other program is Medicaid, which is a state and federal program that provides health coverage if you are in a very low income. And by the way, you can have both, depending on your age and income. You can have access to both programs. Make sure that you understand those two programs. They're absolutely wonderful opportunities. Again, if you're not in low income and you're not 65 and older, you don't have access into these programs, but you do have access to a health plan from your employer or to the open market. Can we go to the next slide, please? What happens if you're unemployed, by the way? Another question that what happens if you lose your job? So if you don't have employment? Bruce mentioned to you that you should do anything to find a job, and indeed we're hearing that the unemployment in the United States is increasing. But we live in a country that, in comparison to the rest of the world, it has one of better unemployment rates. You can't find a job. Please make sure, and actually now with remote abilities to work remotely, more and more companies are actually looking at for talent within our different states. So be open to look at for that employment. But in case you lost it, you can get affordable health insurance through the marketplace. I mentioned to you about the marketplace, and you can actually qualify for low cost coverage through the Medicaid. Also there is a children health insurance program. If you lost your job, and what you can do is, if you lost your job through your employer, there is also COBRA available to you, and at the same time you have also the ability to choose a marketplace insurance plan. Let's talk a little bit more about COBRA, because many people don't understand that they have that ability, or they hear that COBRA is expensive. I am not gonna say that COBRA is not, but it is a way to provide coverage if you do lose your coverage through your employer. If we can go to the next slide, talking a little bit about COBRA. And COBRA, if you are working for a company and you lost your job, they have to provide or give you COBRA coverage. If you lost voluntary or involuntary your job, in other words, you can walk out of there say, I don't want to work there anymore, even voluntary job loss, the employer is actually responsible in giving you COBRA coverage or giving you COBRA documents. And actually you can look at what it is and decide if this is good for you or if you want to go to the marketplace to receive that coverage. And by the way, all this, again, is available to you. The site that you can see and understand this is the Department of Labor. If you go into www.dol.government, there is a whole section that is called Health Plans and Benefits, and there is a whole section on continuation of health coverage, COBRA. Absolutely wonderful resource. Let's go to the next one here. Yes, next slide. Now, I mentioned to you a lot, actually, but this is, so if you're working for an employer, there is also some other things that are actually offered, and some of them are paid by the employer. They give you a vacation, they give you holiday and a paid time off. Also, some employers, they offer a dental, vision plan, a life insurance, and a pension plan. So, you are required to select this during the open enrollment. If you do work for an employer and they're talking to you about open enrollment season, this is exactly why they're giving you the opportunity to make selection. The benefits on the left-hand side, a dental, a vision, a life insurance, or a pension, they're available to you through that season, and changes can only be made during an open enrollment period. So don't look away on materials that you do receive from an employer, because they're asking you to make this selection. Spend some time to understand. If you are working for an employer, their health insurance plan, most likely it will be cheaper than actually going to find a plan in the open market, which you can, by the way. It gives you the ability to go in the open market, in any of the government sites, in any of the marketplace, and compare the plans and see what is between your employer and the open market. I bet you most of the times the employer will offer you a much more cost-effective plan than the open market. If you don't work for an employer, you can actually choose a health plan in the open market, as I mentioned to you. And lastly, if you have neither and you need to address a medical need, don't stay home and try to avoid. Please reach out to a medical provider. You can, as I mentioned to you on my at the beginning, it's important that you have health coverage, but also it's important that you take care of yourself and reach to a medical provider if you need to see one. Pay out of pocket if you have to, and if you don't have health insurance. Now, this concludes my topic. There is a video, I believe, and Alexandra, and Andi, I'm gonna pass it on to you guys. I don't know how you want to handle it. Do you want to do questions? Do you want to do the video? Or it's up to you on how you want to handle the next couple of more minutes that are left.
Thank you, Maggie, so much, and Bruce, for your informative presentations. I think we all will benefit from this, even if we are much younger and still on our parents' health insurance. It's good to know for the future. We will now show a video. Let me just...
How to pick the right health insurance plan. How do you find a health insurance plan that fits your budget and meets your needs? A good plan protects you and your family at a price that's right for you. You can feel safe knowing that all marketplace plans cover a core set of essential health benefits, like checkups, having a baby, emergency care, prescription drugs, and more. Most marketplace plans must also include free preventive care, like shots and screening tests. And don't worry if you have a pre-existing condition. You'll see the same plans at the same cost as everyone else. You can't be denied coverage. Here are a few things to think about before you look at health insurance plans. Health insurance is a contract between you and your insurance company. You buy a plan, and the company agrees to pay part of your medical costs when you get sick or hurt. Although all plans in the marketplace cover a core set of benefits, the amount you'll pay will be different from plan to plan. In general, if your monthly premium payments are low, the cost of getting care, or how much you'll pay out of your own pocket for things like prescriptions or hospital stays, will be higher. And if you pay more each month for your premium, those other costs will be lower. Finding a good health plan means balancing how much you pay each month with how much health care you think you and your family are going to need during the year. If you're healthy and don't go to the doctor very often, then a plan with a low monthly premium will probably cost you the least. But if you need to go to the doctor a lot or you need a lot of expensive prescriptions, you should look at plans where the cost of getting care, or how much you'll pay out of your own pocket, will be lower. If you really need a lot of health care, spending a bit more on your monthly premiums will actually save you money in the long run.
Okay, and there's just one more video.
That was really a summary of my presentation in without an accent.
Okay.
Healthcare.gov is open this year for you to sign up for a health plan. It's open November 1st
to December 15th.
Plans cover wellness visits, prescription drugs, and more. Healthcare.gov open enrollment. November 1st to December 15th.
Not to forget about government if you don't have a plan through your employer. Oh, by the way, all colleges, they do offer health plan for students. So if you are a student, check out the plan that is covered through your college.
I didn't know that.
Yes. Actually, at the time of registration, you choose if you're going to take, if you have coverage or not. There is part of the registration process through your school.
Andi,
yes.
Did you know that?
I did actually.
Wow. Learn something new every day. So for additional information about our about HR benefits and other things that we've covered today, as well as COVID resources, you can find them on our Fuel for Thought website under our Resource Center and under HR Articles and Resources.
We'd also like to invite you all to subscribe to Fuel for Thought's advisory YouTube series. And so there you'll find recaps of all our previous seminars. The link will be posted in the chat below, as well as to Roos Advisors advisory YouTube series. That link will also be attached in the chat.
So now we are going to move into our Q&A session. Just give me a second. So the two links in the chat are what Andi just said. So our first question in our Q&A is for both of you, Maggie and Bruce. Our question is, what can we do when we're first hired to make sure that we are choosing the best possible benefits plan? Do we have to plan from everything in advance, or can we initially hold off on long-term financial planning options? Bruce, would you like to start?
Yeah, so there is a time limit when you first join a company to sign up for health insurance. You can't, there's not really a mechanism to say, I want to defer. You certainly can take as much time as the plan allows you to take to talk to people about the the insurance and the services and what's available to you. I would just add to something that Maggie said really, really well, and that is almost always, because the employer is participating in a portion of the cost of your health insurance, it's cheaper than what you would find on the open market, unless you choose to have less of a value of insurance, unless you choose something that has less coverage in it. So you can't really just say, hey, I'll get back with you in 6 months. So if you miss the open enrollment period as either as a new employee or during the open enrollment period, you have to wait until the next open enrollment period, unless you have a catastrophic event. So I would say do what you can leading up to that. There'll be plenty of information for you to review, and again, my hope is that the employers will do more to help you understand it. And typically, if you go and ask, they will give you more information. They will take the time, but they don't always just make it easy to understand. And Maggie, you may have some other thoughts on that.
No, absolutely in agreement with you. And what I would say is, because they're going to give you a whole packet of a lot of benefits to choose. Start with a health plan. Choose a health plan. The other benefits, if you want to take your time to select and understand, take your time. The number one is you have to select a health plan, select a dental and or vision if you need one, depending on your situation. And then the rest of the benefits, they offer you life insurance, they offer you disability, all kinds of things that if you need your time to understand, take your time. They still going to be on a period of, you still have like that period that you need to make the selection, but at minimum, made your selections on your health insurance, because chances are that it's cheaper than anything else that you can find in the open market.
Okay. Next question. Are there specific financial, administrative, or medical contingencies we should gradually upgrade or increase over time during open enrollment periods? Maggie?
Yeah, great question. It all depends on, of course, your health situation and on, in other words, the more maybe particular diseases or particular conditions you have, you or your family, you need to take that into consideration in choosing a plan. The healthier you are, maybe, and if there is many plans, some employers give you choices of different plans. The healthier you are, maybe the less health insurance you buy or the less cost you have, but it is a matter of giving you assessing your plans based on your personal needs, and also looking at other items that can be covered from a plan. For example, do they have an FSA account or HSA account? I do not cover those. Those are taxable, I guess, financial opportunities that you can actually save some money to address in your health plan. Take a look at the documents, make decisions, again, looking at what is your state of healthiness, if I can say that, before you make, and your families, of course, if they're covered through that health plan, before you make selections. Understand FSA and HSA, all this information is there on the internet, and you can actually find details on the internet.
Bruce?
I was just going to say, I agree completely with what Maggie said. I think it really depends on, one of the things that I think is a decision maker on a recipient's end is how much risk they're willing to take and what condition they're in health-wise and what their family circumstances are, right? So when I first entered the workplace and I was married, we had what I would call just a really, really basic plan, because the premium was really low, which was good for us, and we got wellness and we got a few things like that, but we didn't need all the other things. Well, then we started having children, and we started having orthodontia, and we started having eye stuff, and we had pregnancy, and we had complications with some of our kids and so forth. And so we needed a more robust plan, which cost more, right? And we always were weighing what our needs were versus what the costs were and what the risks were. And those are decisions that you can get a lot of information about, but at the end of the day, it has to be something you feel is the right thing for you.
Mm-hmm.
Yeah.
And frankly, most companies will offer you more than one choice. They'll say you can either choose this kind of plan or you can choose this kind of plan, and or you can go to the market, right? And so that's you weigh those things and you make the best choice for you.
Another question we have is, are there specific contingencies in place for employees on furlough or working for the same employer on renewable short-term contracts for several years? Bruce, would you like to start us off?
Yeah, there are conditions, and Maggie can speak to those conditions specifically, and I think she'll handle that side of it. But what you want to have happen is, in a furlough situation or a reduction in force, you want to make sure that if that happens to you, that you understand exactly what the employer is talking about. Furlough or reduction in force may mean we plan on bringing you back, but we don't have any specific date. So here's what we're going to do for you. We're going to offer you 90 days of health care, and after that, you're on your own. You have COBRA or whatever that gets bolted onto that. It may also mean that we have no intention of bringing you back at any time soon. So we're giving you 90 days, and that's the end of it. So you want to make sure you understand exactly what the employer is saying to you in terms of the commitment and what that means. One of the things about, for example, why that's important is, yeah, you can have COBRA, which is a continuation of your benefit, but you have to pay the full premium, which includes the former employer portion. So it's very expensive, right?
Yeah.
It gets very expensive very quickly, and you need to make sure you understand that. And oftentimes what ends up happening is if it's not a mass furlough or a mass reduction in force, you have a little bit of the ability to negotiate that, right? And so you want to get as much of that taken care of as you can, so that you're protecting yourself and your family. Maggie, what do you think?
No, Bruce, I agree with you. And by the way, a furlough is better than actually a reduction in force. Just to, like, if you're going to hear these words, furlough is much better than a reduction on force. What happens with the furlough, the employees stop paying you your base salary, but many employers, they continue paying for your benefits, or they actually keep you whole from a benefit perspective. You need to understand the current situation. It is cheaper for the employer to forego your salary, but pay you your benefits and keep you as part of the workforce, and that's the work furlough. That's exactly what it means. They're saving because it's cheaper to actually only cover a particular piece of your benefits. So it's not as detrimental to your health plans or your benefit plans as if you're losing your job. Because if you're losing your job, coverage stops from the employer, and then they give you, you have the ability to get into COBRA. Understand the situation. Understand the documents they're going to give you. They're all required to give you documents depending on the situation. Do your search on the internet to understand what's happening, and choose wisely for yourself and your family.
Thank you, Maggie. We're going to move on to our fourth question, and this is directed to Bruce. Bruce, are there any reduced benefits and services that we can expect to face during the pandemic?
Well, it depends on the impact of the organization or on the organization. I mean, I think, for example, I consult with a company right now that provides cellular services for T-Mobile. They're a third-party vendor to T-Mobile. This will be the best year they've ever had. And they'll be paying bonuses, and they'll be looking at renewing their healthcare and their employee benefits at a level higher, no doubt, than they were a year ago. On the other hand, I consult with a healthcare company that's struggling, and they're looking at how they can still provide health insurance and employee benefits at a level, probably at what I would describe as the highest level that they possibly can. right? Which will be a reduction, quite frankly. So, you know, I think to your question, I think it really depends on what the circumstances are for the organizations themselves. I think you just heard from Maggie earlier that if you're in the portal, getting benefits through that portal, that's the system that the government has helped us provide, you're going to see a 6% increase across the board. And one thing, just so everybody understands, one of the biggest issues regarding healthcare is claims, how much we utilize the services that we have. And we in the United States, we use it. We use them a lot. And so, you know, that drives costs. So all the employees say, well, you know, how come it keeps going up and my benefits keep going down? Well, it's because the company has to pay for a certain portion of those. They have to be able to afford those costs, and they have to be able to manage those costs. And so the way they manage it is premiums go up, or deductibles go up, or services go down in order to make sure that they can handle that financially. I think everybody on the call needs to understand this. Probably the best benefit you get from the company you work for, first and foremost, is a paycheck. Yep. And if a company can't provide you a paycheck, then it's unlikely that they're going to be able to provide you a great deal of benefit, right? So it starts there, and there is a financial ramification to that.
Thanks for the question, Bruce. Thank you. So this next question is going to be directed towards Maggie. Can an insurance provider refuse coverage due to pre-existing conditions, even if the cause of taking on the new insurance was 1, due to a loss of work, or 2, the employer has switched to a new plan?
Yeah, I get this question a lot, and maybe this is from many years ago, but pre-existing they don't. I mentioned to you that all health insurance plans, they have to offer you those 10 basic things, if you remember. It did not say, no, we won't offer you except if you have a pre-existing condition. So it's one of the frequently asked questions. First of all, when you're on an employer plan, think about it. They don't know anything about your pre-existing condition. And just to make it very clear, they give you a plan. You select the plan, you have that plan effective as of the day. Usually it's at the day of hire or first of the month of next month, first day of the month of next. They don't know about your pre-existing condition, and they cannot actually exclude you from that pre-existing condition. The same is true for if you go to the marketplace. Now, what happens is your claims and your use of medical care, it will be expensive, but you won't be not provided a health insurance plan because of a pre-existing condition. Bruce, anything you want to add on that?
No, that was perfect. That was well said.
So that seems like that was our last question. We're going to move on to our closing remarks and announcements now. So we'd just like to thank everyone for joining us today. We have a few announcements, one being our Founders Day Facebook fundraiser is running through November 1st. So we ask that you please give what you can to support our free online programming. That Facebook link will be posted in the chat below. We'd also like for everyone to join us during our next seminar, which would be on November 21st. And this will focus on managing key college to career transitions. Lastly, there's also still time to enter our Instagram contest. And this is showcasing your revamped workspace for a chance to win VIP membership that's worth $150. Please don't miss out on the opportunity, and the deadline for submissions is October 31st.
We also want to just announce that we're accepting spring 2021 interns. So if you are interested or know anyone that's interested, have them visit Fuel for Thought's website, which I will attach below, or email us at p4tinfo@gmail.com. In other announcements, we have NHSA's annual conference on November 14th, which will be held from 11 to 1:30. And last but not least, a shout out to Hellenic young professional Eleni Efkarpidis and her amazing Lyra Bracelet Awareness Initiative. Since the 1800s, the minority Greek American and African American populations have banded together in solidarity against intolerance and inequality. Lyra stands for Learn, Educate, Response, and Act, was established in response to the Black Lives Matter movement. And to get your Lyra bracelet and support the initiative, we will attach the link below. Great job, Eleni, who's with us today. Chris, if you would like to.
Just one last remark. As Chris mentioned previously, this seminar is dedicated to Bertram Scott. He was a retired director of the NYC Department of Health, who passed away this year, unfortunately. Mr. Scott was responsible for creating many opportunities for skilled minority health specialists, including many members of the Greek American medical community. He was particularly responsible for the hiring of the first female and first Greek American to hold the title of Assistant Commissioner of the Department of Health.
Thank you, everyone. Thank you so much to Bruce and to Maggie for being our guest speakers. Eleni, congratulations for this wonderful Lyra bracelet movement. I applaud you because actually Mr. Scott, who we're dedicating today to, was you 30 years ago. So I'm glad that we have someone else who is paying attention, and I'm glad that it's a young person because that means that the initiative will last longer and make more progress over time. All right, so applause to you. And I want to thank, of course, our wonderful co-moderators, Alexandra and Andi, for doing such a great job. All right. And if you have any questions for us, please make sure to email us at p4tinfo@gmail.com. And you can have questions just to Bruce or to Maggie or to one of our other guest speakers from previous videos. All right. I wish you all a great weekend and a wonderful rest of the year ahead. All right.